Hey everyone, I'm Dr. Casey Miller. I'm an Airrosti certified provider here in Chicago, Illinois. Today we're going to talk about low back pain. We're going to talk about some of the causes of low back pain, how it typically will present itself, how traditional practitioners will typically address the issue, and how here at Airrosti we do things a little bit differently. Let's get started. Okay, let's talk about some of the causes of low back pain. First, let's take a look at the anatomy of the low back. The low back actually consists of 6 different layers of muscle: tendons, ligaments, joints, discs, and fascia. That connects the hips, the ribs, the mid-back, the shoulder, and even all the way down here into the thigh bone. Because there are so many different structures associated with the low back, there are lots of different causes of low back pain. For instance, muscle imbalances, sprains and strains from injuries, disc herniations and bulges, and even poor posture from prolonged sitting. In fact, a study in the Washington Post just identified the fact that the average American sits for around 10 hours a day, which is a lot of sitting. What's more, the New England Journal of Medicine just announced that over 2/3 of the population of Americans will suffer from some sort of low back pain at some point in their adult life. So, how does low back pain typically present? Again, because there are so many different structures involved with the low back, there's a lot of different types of presentations. For instance, we can have a muscle spasm, we can have a dull, achy discomfort in this region, we can have sharp shooting pain that can travel either up towards the mid-back or across the back or sometimes down into the glute region. We can also have some traveling pain that starts from the low back and travels all the way down into the lower extremity. There's also typically some inability to stand upright, along with stiffness and lack of range of motion. Let's talk a little bit about how traditional medical practitioners will address low back pain. Typically, these practitioners are going to prescribe rest, ice, oftentimes anti-inflammatory or pain medications as well, in order to reduce the pain and swelling. Sometimes they'll even prescribe some injections, potentially costly imaging such as x-rays or MRIs, which may or may not tell you what's going on underneath the surface, and other times they may even prematurely suggest surgery. While all of these measures can totally be beneficial at times, sometimes they're not, and other times they can be a little bit more costly and take a little bit longer to resolve your pain. Let's talk about how Airrosti is a little bit different. Here at Airrosti, we spend 60 minutes with each patient every single visit. The first visit is going to be geared towards finding out exactly what's going on with the pain. We're going to do a thorough evaluation, and we are going to do some orthopedic testing, muscle strength, range of motion, and functional testing in order to determine the root cause of the pain. From there, the first 30 minutes of the appointment is going to be dedicated to using highly specific, focused manual therapy in order to reduce pain and improve range of motion. We're going to pair that with the second 30 minutes of the appointment with active care, where we're going to give each patient a very specific and personalized active care plan, which will not only support the manual therapy, but it's going to help treat the underlying cause of the injury. That combination of the two is geared towards getting you back in action, doing what you love to do as quickly as possible, and of course, pain-free. So really, the difference at Airrosti is that we are going to fix the root cause of the pain instead of just treating the symptoms. Thanks again for hanging out with me and talking about low back pain. I hope you found some of this information very helpful. If you do run into any symptoms whatsoever, please don't hesitate to reach out to Airrosti so we can get you back on track as soon as possible. Thanks again for watching, and we'll see you again in our next video.